Good day everyone, I am Joanne Dadag and today I am with Ms. Diane Monique Sibayan and Mr. Dustin Calvalayo, and we are taking a program of Bachelor of Science in Nursing in Wesleyan University of the Philippines. So we are here to discuss to you about the Barangay Health Workers, a program under the DOH. So specifically for this topic, we will be tackling the meaning or the definition of a barangay health worker, also the roles and responsibilities of BHW, or what we call as a barangay health worker, and also the Republic Act that supports their rights as well as the incentives and benefits of the BHWs. So first of all, what comes to our mind when we talk about barangay health workers? So health workers, we are already informed that a health worker is a person who works for the health of the people. But here, it is termed as barangay health worker, so specifically they work in a barangay. So according to RA 7883 Section 3, a barangay health worker or BHW is a person who has undergone training programs under any accredited government or non-government organization and who voluntarily renders primary healthcare services in the community after being accredited to function as such by the local health board in accordance with the guidelines promulgated by the DOH. So in short, barangay health workers are the health workers who work in the barangay. So primarily it doesn't only consist of the 4-year graduate course that are related to health. It can be people or health workers that has been accredited by a government or non-government organization under the trainings of the health-related programs. So they can be sanitary inspectors or RNs, doctors, and they can also be barangay captain, barangay tanods. They can also be volunteers in the barangay. So now, to furtherly discuss who are the barangay health workers and their roles, first, we will go to the community organizer. So it says here that a community organizer is the people or the health workers that participates in organizing and mobilizing the community towards self-reliance. This includes maintaining regular communication and linking the community with the local leaders and healthcare professionals. So in short, the community organizer, they are the people who organizes the community towards self-reliance. So as health workers, we are not just there to provide the people with health services. We are also there to health teach the client, for them to attain the self-reliance for their health, in order for them to not depend on the health workers for their health maintenance. So maintaining regular communication and linking the community with the local leaders and health professionals. So they will be the one to inform the leaders and the health professional what is happening on the health of the people. So it also says here that they also assist in the community from the identification of health problems. So as I've said earlier, they will inform the community as well as the leaders and health professionals in the community about the health problems of the people, the development of health plans, and in taking action to promote their health and well-being. So they don't only inform the leaders and the health professionals or the doctors, the medics, and the nurses. They're also part of the planning for the health of the people and also in taking action to promote the health and well-being of the community. So next role of a barangay health worker is that they function also as an educator. So an educator are the BHWs that provide updated and timely knowledge and skills to community members in the prevention and management of simple illness and in relevant health issues. So for example, there is an outbreak of dengue in the community. So the function of the BHWs as a community educator with regards to the health prevention is that they can teach the community how to sanitize their environment in order to prevent dengue. They are also designated as barangay level health promotion officers in accordance with the Health Promotion Framework Strategy and in support of the UHC Act. So one thing I would also like to add for the barangay health workers as an educator is their importance in the prevention and management of the diseases. So for example is this COVID-19 pandemic. So barangay health workers, they function to promote the vaccination program of the government to the community. So they can function as an educator to inform the people what are the benefits of taking the vaccines and what will be the health threats or what will be the possible effects if you will not get vaccinated. So BHWs plays an important role to the health of the nation by informing the community. So lastly, a BHW can also function as a primary healthcare service provider. So it says here that it assists or he or she may assist health professionals in rendering primary care services in the community for which he or she is trained to do. In addition, he or she shall help professionals by monitoring the health status of the community members, keeping the records of health activities, and ensuring the maintenance of barangay health centers or stations, including the safe custody of equipment, supplies, and health records. So, as a BHW, and the function of a primary healthcare service provider, you can render care by promoting maternal or child health or by giving first aid to a community member that is needing it, and also by providing education regarding the environmental health. A primary healthcare service provider can also link the clients to other healthcare facilities if necessary. So in short, a primary healthcare service provider is the first in line that the community can approach when it comes to health, and it is the most accessible for them because they are present within the barangay.
Okay, so we have learned from Ms. Dadag that our barangay health workers have different roles in our community. So, from their different roles, wouldn't it be nice if they receive some kind of incentives and benefits from the job they do? So, actually, we have here a Republic Act that states that our barangay health workers should be accredited for voluntary health services. So this Republic Act is known as the Barangay Health Workers Benefit and Incentive Act of 1995. In this act, we will be talking about the different kinds of benefits and incentives that our barangay health workers can actually receive. Okay, so what are the incentives or benefits that our barangay health workers can receive? First, we have here our hazard allowance. This is the condition where our barangay health workers are exposed to situations, conditions, or factors in the work environment or place where foreseeable but unavoidable danger or risk exists, which adversely endanger his or her health and increase the risk of producing adverse effect on his person in the exercise of his duty, to be validated by the proper authorities in an amount to be determined by the local health board and the local peace and order council of the LGU concerned. So, our best example here is the nurses that are on duty on the COVID isolation area where they're risking their health and exposing themselves into the virus. So they are the one that receives hazard allowance. Next we have is the subsistence allowance. So who receives this kind of benefit? So the barangay health workers who render services within the premises of isolated barangay health stations in order to make their services available at any and all times. This shall be equivalent to the meals they take in the course of their duty, computed in accordance with the prevailing circumstances as determined by the LGU concerned. So those who receive the subsistence allowance are those barangay health workers that specifically goes to a remote barangay where there is a little to small amount of health workers present. So they are the one that goes there and provide their services to make it available for the remote barangay.
So continuing on, training and education and career enrichment programs, or as we call TCEPs, the DOH, in accordance with the Department of Education and other concerned agencies and non-government organizations, shall provide opportunities for educational programs, continuing education, scholarship benefits, and special training programs. So as you can see here, the DOH, in accordance with the Department of Education, will help us as BHWs or barangay health workers to provide us opportunities for educational purposes. As we can see here, the educational programs, continuing educations, scholarship benefits, and special training programs. So next is civil service eligibility. Second grade eligibility shall be granted to BHWs or barangay health workers who have rendered 5 years continuous service as such, provided that should the BHW become a regular employee of the government, the total number of years served as BHW shall be credited to his or her service in computing retirement benefits. And for more information, you may visit this link. We're gonna put the link down below there, and or inquire with the nearest CSC regional office. So just becoming a barangay health workers for 5 or let's say more years, the government will credit at that as much, and you might even have a chance on having a job at the government permanently. So that's a very good benefits as well. Next is the free legal services. So the legal representation and consultation services shall be immediately provided by the Public Attorney's Office or PAO in cases of coercion, interference, and in other civil and criminal cases filed by or against BHWs arising out of or in connection with the performance of their duties as such. So in terms of, let's say, let's say in terms of law, the Public Attorney's Office will provide us, the BHWs, a attorney for us just in case if ever something happens. And that's one of the benefits as well. That's a very good thing, because in our duties a lot can happen, and just knowing the Public Attorney's Office is there for us is such a benefit as well, right? So the next is preferential access to loan. The agencies providing loan services will set aside 1% of their loanable funds for organized BHW groups that have community-based income generating projects in support of health programs or activities. So when it comes to like something for the community based, which is like, we are barangay health workers, right? So in terms of having the community based income, something like that, or something project that you are supposed to do, the government is open to loan the money that you will need for the project. So that's a benefit as well. So that would be all for the that would be all for the benefits and incentives for the BHWs. So you won't have just one or two. You will have like 6 benefits and incentives as a barangay health workers, and that's a good thing, right? So we can say that being a barangay health workers is not just a simple thing to do. It gives you a lot of benefits as well, and doing a 5 or more years in a barangay health worker can give you a job permanently in the government as well. So that is really such a good thing. And if you want to know more about that as well, the link will be provided below. You can read there if you're more curious about the benefits. So that would be all as we can talk about here. Thank you for listening. So I will be speaking for Miss Joan Dadag and Dominic Sibayan, and for me, Dustin Calpelayo. Thank you for listening, and have a good night. Thank you.